All right, looks like we got about a dozen or so participants, so we'll go ahead and kick this off. So hello everyone, welcome to our virtual panel on evaluation practices during a pandemic. I'm Nicholas Hayen, I'm the incoming MINN president for 2021. During the day, I work as a global program manager for United Language Group. They're a translation, localization, and interpretation company, and my program focuses on corporate, government, and international NGO translations. For those of you who are new to MINN, the Minnesota International NGO Network is a nonprofit organization that seeks to provide a forum for international practitioners and supporters to learn, network, and exchange professional expertise. We have a variety of events throughout the year that are designed to help share our collective knowledge and experience about doing global good better. If you haven't already, please follow our social media feeds and become a MINN member at minnesotangos.org. We are also wrapping up our Give to the Max drive, as I'm sure all of you are too. So we encourage everyone to go and make a contribution at givemn.org/story/min2020 if you like this event and if you want to see more content like today's panel. And I'll be putting those links in the chat as well. Our moderator today is Ann Betzner, who serves as a current MINN board member and has provided extensive support on our programs committee. Ann is a vice president for programs and evaluation at Children's HeartLink, a Minnesota-based NGO that saves children's lives by transforming pediatric heart care in underserved parts of the world. Ann oversees program development and standardization, program impact measurement, quality improvement, and research efforts. Before joining Children's HeartLink, Ann served as a senior research scientist at Allina Health and was vice president for a research and evaluation firm. Ann has a master's degree in policy analysis and a doctorate in research methods from the University of Minnesota. So I think she's a tremendous moderator for today's event. Ann, thank you so much for moderating today's discussion. And if you would, just tell us a little bit more about what we'll be hearing today.
Yes, thank you, Nick. So as we are all aware, COVID-19 has upended our worlds, including what and how we evaluate. So today's presenters will describe their experiences and perspectives on how to wisely use evaluation resources, priorities for what our evaluations should address, and the methods that we might consider using in our new COVID world. And so we'll start with Grace Field. She will be discussing mobile data collection. We have three presenters. I'll introduce each before their presentations. Presentations will be 10 minutes each, and we'll have about 20 minutes at the end for questions. So I'm going to screen share here and bring up Grace's presentation to start. Okay, so Grace is a registered dietitian nutritionist with 5 years experience in developing and humanitarian context. She was originally clinically trained. Grace has since supported nutrition program management in South Sudan before shifting to focus on nutrition assessments, including SMART and Link NCA. She has experience directly and remotely supervising surveys using mobile data collection devices, including in the COVID-19 pandemic. And when I had the opportunity to chat with Grace virtually, she shared that one of the things that she's particularly enthusiastic about with evaluation is really being open to learning and improving the way and that is what really excites her about this work. So I'm very pleased to introduce Grace and her presentation on mobile data collection.
Great, thank you so much, Dr. Betzner. So I'm going to talk a little bit about mobile data collection for monitoring and evaluation during COVID-19. So mobile data collection was on the rise and becoming a norm prior to the pandemic, but it's particularly relevant now when programs really need to ensure the protection of the vulnerable is at the heart of any response or evaluation. And then that response agrees with national and local responses and national and local guidelines that often are limiting in-person contact. And when it comes to monitoring and evaluation, door-to-door surveying or data collection probably is not appropriate at this time. Thus, if possible, surveys can be conducted via mobile phone calls on an electronic questionnaire. So you see at the bottom of this slide kind of three modalities for data collection, where the rightmost, household visits, is more the traditional form of data collection, where in COVID-19 or in this pandemic, that would require personal protective equipment for both parties involved, a distance of 6 feet, and even with those precautionary measures, we'd still be really concerned about any risk we might be predisposing on the household. Whereas on the left, you see some alternatives where mobile data collection can take place with phone calls that data is then inserted onto tablets, or calling households and doing online data collection. So inserting that information onto a computer. Next. So today's objectives, I'm going to speak briefly about mobile data collection during COVID-19 using Living Water International's experience implementing a knowledge, attitudes, and practices survey as a case study. So on the right, you see a map of Living Water International's program countries from back in April, where red represents countries that were in the emergency classifications by the World Health Organization standards, and yellow represents countries that were in cluster transmission at the time. And what Living Water really wanted to do was to have an effective listening tool that allowed countries and their staff to modify their COVID-19 sensitization strategies and programming if needed. And the target audience for the survey was community leaders in these contexts. Next. So as is true with any survey or any evaluation, the first step is planning. So an important question to think about is who. The survey team needs to include staff for planning the survey, including defining the methodology, doing any hiring that's needed, and crafting the budget, designing the questionnaire, conducting training, and monitoring progress. How it should be done, well, it's a little bit outside of the scope of this 10-minute presentation to talk about all the various options that one has for mobile data collection platforms, but priority should be given to data collection platforms that the team has experience with, whether that be Kobo, ODK, social cores, etc. It's really important to not assume that enumerators can or should use their personal phones or laptops for these calls. Next, an important question to think about is where. Mobile surveys should be planned in areas with cell network coverage. While planning, ask oneself, will my survey still be representative of the intended geographic area and or population if those areas without network are excluded? So thinking of Living Water International's example, we chose community leaders in part because we didn't think cell network coverage or mobile phone ownership would be high enough for household members that the survey would actually be representative of those populations. Next. So when calculating the sample size for a mobile survey or mobile evaluation, it's really important to plan for a higher rate of non-response and or refusal. Frankly, it's easier to say no or avoid a call than perhaps somebody knocking on your door. So use higher non-response rates in your sample size calculation, buffering up to 50% of non-response depending on your context. In our experience, the non-response rate ranged from 68.9% to 89%, but I put an asterisk on the 89% because for that example, we went ahead and excluded regions of that country that we knew would be really low mobile network, and we weren't going to have success in that area, so it wouldn't be representative. Considering network challenges, don't expect everyone called will actually be reachable. So it's important as a team to define your expectations of unable to contact respondents. This should be more than once, but it also should be realistic. You don't want staff to be calling somebody 20 times in a row. So for our purposes, we determined somebody would be a non-response if we could not reach them on the third try. Next. The next steps after those planning steps are to develop your questionnaire. So it's important to list up to 5 outcomes that you care most about. For our survey, this was 3 outcomes: knowledge, attitude, practices. Next, you want to trace each of these outcomes to what you need to measure to compute it. There's some special considerations that you should make. For mobile surveys, close-ended questions are preferential. Quick responses are much better than leaving it open to long answers. Next, it's really inappropriate to include sensitive questions in most mobile questionnaires because we're not able to monitor the home environment on the other end of the receiver. And it's just really difficult or impossible rather to read body language over the phone compared to when sitting with someone in person. Next step is to match indicators to outcomes. So you'll see on the example I've put at the bottom of this slide where I've actually matched various questions to the outcomes that we cared about. And then I assigned an estimated time for each of those. We had discussed a total budget for the questionnaire in terms of time. So my budget was 15 minutes. Our questionnaire should not be more than 15 minutes. And because the total questions that we had listed were more than 15 minutes, we voted by time per indicator. So the various technical experts on staff kind of voted their preferences. We made sure that each of our outcomes was represented, and then we only could afford 15 minutes worth of questions, and the questions that received the least rankings were not included in the final questionnaire. Next. It's also important to think of different options you'll need for survey closure over the phone, namely that second option, partly completed. The questionnaire was not able to be finished, perhaps because someone started the call and had to leave. That third option, reschedule, if a person does not answer the phone or ask you to call back at another time. And then lastly, that non-respondent option, where if someone did not respond on the 3rd try or whatever your team has decided is a realistic number for non-response, well, then we need to incorporate that into the questionnaire so that it's represented. Next. Next up is training. So it's really important to think of training for mobile surveys as 2-part. One needs to cover the technical content of the survey. So the same content of that training that would take place in person, meaning it needs to cover informed consent, translation of questions into local dialects if needed, role play, and survey norms. But there's a whole different training component in just the mobile administration of the survey, the nuts and bolts of mobile data collection itself. So that includes downloading the application onto devices, making sure everyone is comfortable with that application, recording and saving forms, submitting them for upload, and tracking progress. Practice makes perfect. You need to pilot this process from start to finish, including submission. So a proper pilot will include testing all the technical contents of the survey as well as the mobile administration of the survey itself. Next. Mobile data collection requires stronger monitoring, especially if the numerators are not in the office, which was the case in our case study. You really need to investigate alternative means of supportive supervision. So in some places that looked like setting up a WhatsApp group with staff. Other places email worked fine, or in some contexts there needed to be a daily phone call between the survey manager and staff making calls. You need to increase the frequency of your back checks, tracking actual versus expected progress, especially considering that those conversations probably aren't taking place in person between the survey team. And then at the bottom, you'll see an Excel workbook that I made for making and tracking appointments for this survey. So we had multiple staff calling various people. So we used this Excel sheet to track our first call date, our second call date, and our third call date if needed, such that if someone wasn't reached on the first try, we made sure we knew who was going to be calling that person again on the second try. Next. So just some key takeaways for planning a mobile data collection. Keep the content and duration realistic. My rule of thumb for a mobile phone call would be no more than 15 minutes, but that can vary between contexts and by need. need to assume a low response rate, plan for a lot more people than you need for analyses. You need to ensure enumerators have the required equipment for phone surveys before they come to the training. And in some contexts, that also looks like making sure that they have mobile calling minutes so that they can complete calls. Training needs to consider technical content and mobile administration as two separate trainings. You really need to allocate sufficient time that the team just has expertise in both of those areas. Dedicate time to thorough translation if needed, and it's just really important to invest in time for practice. Lastly, for implementation, you need to assume that additional monitoring will be needed and utilize a tracking workbook or some other means of monitoring progress. Next, because of the global situation we find ourselves in, and that house-to-house visits probably aren't going to be ethical or realistic in the near future, we really need to thoroughly document non-response rates and lessons learned from these processes such that they can be duplicated by other actors working in the same areas. So that's all that I have for you today. Thank you so much for the opportunity, and I look forward to your questions.
Well, thank you, Grace. I think we all know that evaluations are only as useful as the quality of the data that we get. And so what you've talked about is how to get some high quality information. And so thank you. And I'm sure there'll be many questions at the end of our presentation series. I'd like to introduce Satlaj Dika. She is an evaluation scholar, researcher, and practitioner based in the Twin Cities. She's a PhD candidate in the Evaluation Studies program at the University of Minnesota. Her research interests lie in the areas of evaluation capacity building in the Global South, culturally responsive evaluation practice, and evaluation of complex health interventions. Satlaj is involved with evaluating special educational programs aimed to increase high school graduation rates of ethnic minority students with disabilities. And before relocating to Minnesota, Satlaj worked with community health and human rights initiatives in India, Laos, and Ethiopia. She has continued her engagement with organizations in the Global South and supports community-based organizations to design and implement strategic planning and evaluation capacity building processes. And when I asked Satlaj what she loved most about evaluation, she shared that she loves to know how things work and is always super curious how programs work, what makes them successful, what people like about them, what they don't like, and what can be tweaked to make them better. And she gave a really lovely metaphor that evaluation gives her a chance to know the program recipe. So with that, look forward to your presentation on evaluating during a pandemic, challenges and solutions for the Check and Connect program.
Thank you, Annie. Thank you for this wonderful introduction. And I'm really, really happy and excited to be here and sharing this with all of you. I know we have hard stop at 1, so without further ado, I will start the aims and objective of today's session. So first, I would like to review overall challenges and implement implications of COVID-19 on evaluation design and implementation. And I will do this with the help of a case example, and that is the current evaluation work that I'm engaged in, Check and Connect. So I will give a brief context of the work that we are doing, and then we will discuss the challenges and the strategies that we have adopted to address COVID-19 challenges. Next, please. So here it is, COVID-19 and the challenges for our times for nonprofit programs. First thing first, our context changed. Like government's priorities changed, the partners and some community members, donors who were supposed to be with us changed their priorities. How we implemented activities changed drastically. So there was overall change in how our programs were situated, are situated, and how, and now the current situation. Then most importantly, there are shifts in, the same slide, sorry. Changes in stakeholder needs and priorities. Suddenly the health priorities or loss of livelihood take precedence in their priorities. As we were discussing changes in program budget, government had to prioritize their budget, donors had to reallocate their funds. So that had implications. And last but not the least, interaction effect of COVID-19 and systemic racism. As we saw in the pandemic, that there is a strong correlation between the race and adverse outcomes of COVID. And that was also a big challenge for us, for evaluators. So next, please. So here is the case that I would like to discuss, Check and Connect program by Minnesota Department of Education. And as we see, Check and Connect is an intervention used with K to 12 students who show warning signs of disengagement with school and who are at the risk of dropping out. Check and Connect is basically it's a trusting relationship between a student and a caring trained mentor who both advocate for and challenge a student to keep education salient. And students are referred to Check and Connect when they show warning signs of disengagement. And in Minnesota, currently the program that we are working on, it is implemented for African American and American Indian students with disabilities. So it has a very clear focus. It is a pilot program implemented in 4 school districts, Osseo, St. Paul, Minneapolis, and Duluth. And the pilot program duration is 6 years. It's a longitudinal study. Next, please. And we don't have to go in the nitty gritties, but I'm laying down because we will be discussing things in terms of evaluation challenges. So main long-term challenges were 3. One is to enhance student engagement. Second is to improve graduation rate. And third, this was a pilot program. So scaling up also featured as a long-term outcome for the state. Next, please. The main program activities were very simple. Mentors checking with students' academic programs on a regular basis, and mentors connecting with students and families to give support and solve problems. And the mentors are of 2 types. For some district, they appointed separate mentors, and for some district, they used their existing staff, teachers and paras to act as work as mentor. And there are series of evaluation instruments. And being a longitudinal study, we are doing this for the last 4 years. So we don't have to go in the detail of this, but there were lots of instruments where scores are like 1 and 2, and each scores were then transformed, calculated, and they were all there to check the fidelity of assessment on which the federal funding is dependent. So it's all, it's all the high stake scoring, and any changes in scoring would actually have effect on the next cycle of funding. Next, please. So before we started, when the pandemic came and before we started to assess how we are going to do this in this year, we have been collecting data in certain way for last 3 years. This is our final year, and then bang, the pandemic came. So before we started, we took a deep breath, and here is something that we did. First, checking program assumption. Like, our main assumption is that higher the student presence in school, more is the engagement. And now the schools are closed. So there we have to revisit our main assumptions. Also, more engagement, more present the student is with mentor is something that is different. And that for that we then did what reassessing relevance of evaluation question. Our evaluation questions were like, student engagement is basically we conceptualized that their presence in school, and that's where something we had to change. Then we had to change the tools and protocols because again that was not feasible and practical, and change in the data collection procedures. Next, please. And here are the specific challenges that we will go one by one. Our biggest challenge was incorporating changes in program activities while maintaining integrity of tools and validity of our longitudinal data. Because we were measuring in one way, so we could not discontinue our tools. We could not afford to suddenly give lower scores because certain activities were not happening. That would have implication our funding, and that was not exactly capturing the reality on the field because lots of other things were going on. Mentors were trying to do many other things which were outside of the instrument that were designed before COVID. So what we tried to do is we redefined our scoring methods. So when we said yes and no to a question, that's what something we changed. And here is an example. So in one of the tools, the original parameters was mentor records data for attendance, behavior, course performance each week of the month. And if mentors did all three things every week, they used to get 1 point. But that was not possible, so we changed our scoring. So mentor record data for attendance and course performance whenever applicable, whenever it is possible. And that's how this is the method that we followed for all our tools. We redefined the scoring without changing the instruments or tools. Next, please. Original data collection procedures were not possible. For example, we relied heavily on focus groups, and focus groups was something that was not possible at all. So we shifted to distance, online virtual Zoom calls. But again, our community is students with disabilities, and many of them were on ASD spectrum. And focus group and online focus group or online one-on-one interviews is very difficult for these students. So then we have to revise our protocols completely, try to have their mentors involved in those one-on-one calls so they will feel assured. We give more time, and this is something we still had to do, but we are planning on it. So we will see how it goes. Next, please. And upon program activities change, but basically a lot of different activities emerged. So mentors could not meet students regularly in the schools, but they assembled and delivered care packages. They started doing porch visits, and so much new and innovative things were happening that were just not being captured with our tools and in our data. So what we did is we just invented new qualitative tools to capture this emerging context. And one of them is just 5 minutes call with mentors. So instead of data coming in through data coordinator, we just started giving calls, just a 5 minutes quick checkup to mentors, asking them what's going on, what are they doing new, what has changed, for whom. And this is the data that we are documenting, and we will try to put it together in this year's report to add more context to our quantitative data. Next, please. Oh, and then earlier, there was one more thing. We started celebrating small victories. So earlier, how many students stayed in the program was not reported. It was assumed. But with the pandemic, we started counting that. We started reporting to teachers and mentors, because this is important. How many students continued with their course? This was also not a data point that we were earlier visiting, but now with the pandemic, we started even celebrating that. Next, please. And here is a big picture of what we can do in complexity informed evaluation. And the crux of it is that just asking question, what changed, for whom, and what does it mean for our program? And just keeping this, we can share this slide. This is just something, a visual that I put together, and it basically captures what I've shared earlier in this presentation. And yeah, and that's what I have for you. And I'm excited for the questions. Thank you.
Thank you so much. I think what you have highlighted is we all understand that quality evaluations need to take into account the context and all of the changes of context that have occurred because of COVID-19. So thank you, Satlaj, for sharing how you were responsive and adaptive to those circumstances. I would like to introduce Kamala Deve Sivalingam. She is an international development practitioner, has been for 10 years, a former UNDP education project coordinator, and CEO of Play for Change. After serving varying leadership roles in mission-driven organizations and the United Nations out of Latin America, she pursued a master's degree in international development. Ever since, she's conducted evaluations across the United States, Asia, Africa, and Europe under real-time and budget constraints. Her hope is that by sharing her cost-effective evaluation tips with the broader community, more nonprofits will be inspired to evaluate their work for greater accountability, justice for program recipients, and organizational learning. And Kamala made an excellent point in our conversation that in the age of false news and widespread misinformation, what she really loves about evaluation is its role in truth telling. And she thinks that evaluation should be used to elevate people's voices, to speak truth, and ultimately to redistribute power where needed. So wonderful sentiments. Thank you, Kamala, for presenting today on cost-effective evaluation tips.
All right, thank you so much for that wonderful intro. So again, my name is Kamala Devi Sivalingam. And actually, like a lot of you on this call, my first experiences in international development were actually implementing programs. So when I was based out of Latin America, I was implementing programs on poverty reduction and education. And I remember how hard it was to make a case for evaluation. You know, why take some dollars and put them towards evaluating a program when you could be serving ultimately more people in the community? And so I know that this is a very tough case to make, but I do see a lot of value in evaluation. And I think that from the experiences of my colleagues and how their teams have been able to adapt during the pandemic, we're seeing that evaluation is possible, that we are able to do it in these conditions. And there are specific tips and tricks that I've been able to use in the field in order to sort of reduce the costs and make that case to do evaluation. So with that, for the remainder of the time for the presentation, I am going to do my best to sort of sum up what these tips are, how you can reduce time and budget, but still be able to evaluate your programs. All right, so we can go on to the first slide and our tip number one. So our tip number one, which may seem kind of straightforward, but really there's a lot you can do with this, is simplify the design of your evaluation. Now, I know I'm not the only one who has been there, who's asked questions that we probably didn't necessarily need to know about a population, or perhaps we're asking a wide audience and maybe that audience could be more specific. And so there are many things that you can do to sort of simplify the design stage of your evaluation so that you can sort of save resources where they're most needed. And mind you, when I say simplify, it doesn't mean that you're compromising the validity of the evaluation. It means that you are prioritizing and you're kind of narrowing in where it's most needed. And so different ways you can do this. If we're looking in different qualitative and quantitative methods, for instance, if you're doing a survey, you can sort of reduce the sample size. If you're doing interviews, perhaps interview less people, or shorten the time of those interviews. Think through the questions, what's really needed within those questions. And then let's say if you're doing focus groups or community workshops, or just a bunch of different data collection events, you can try to coordinate them so that they're all within the same vicinity or area. And I know this isn't always possible, but these are just some techniques that I've used before. And actually, while my team was evaluating a child's rights situational analysis in Thailand, I remember in the beginning of our evaluation, when we were doing interviews with a lot of the key informants on child's rights, we had ample time, or we felt we had ample time. And so the three of us would go from site to site and interview different stakeholders. And some point, towards the middle of the evaluation, we said, we don't have the time to do this, given the time that will be left in the country. So we strategized and we thought, all right, what are the strengths that we have within this team? And that's how we sort of assigned members to specific interviews and decided not to do them all three of us together, but perhaps to do pairs that would go off to different sites to do interviews. So that's just one thing that we did, just to give you a concrete example, but there are many, many ways you can simplify the design. And with that, let's move on to tip number two. Okay, so our tip number two is set indicators ahead of time as part of a long-term monitoring system. So evaluation is something that we should always be thinking of, and we want to make these processes as simple as possible. And it's crazy how if we just invest a little bit of time at that moment when we're designing a program to thinking of what we can naturally collect in the process, how much time and resources it will save you at the end, because going back later on and trying to figure out where to get a baseline or where to track different indicators that we hadn't thought of before, it's very complicated, and it can be taxing for the team and for people who are on the ground. So with that, let's move on to our Tip number 3. All right. So use data and information that's already there. I can't say how important this one is. I can actually say it's very few and far between evaluations that I haven't used secondary data, or also known just as publications, reports, census that are already available. First, because this information can give you a lot of context to start off with. And second, just because the fact that it's been used for another purpose doesn't mean it can't be repurposed and used for your evaluation. And one way that I've used information that's already there, secondary data, is when I was doing an evaluation of a domestic violence program. The shelter, was doing a special trauma-informed response for the women and for the children in the shelter. And what I did then is with my team, we kind of looked at the research that already existed on the web around trauma-informed response, brain science of what happens after people have experienced these very delicate situations and what can be done in order to address them. So all of this research and information was very handy, and we thought that it would just help orient us. But we actually ended up bringing in a lot of those stats and figures into our final report. And you can too, actually. And with that, let's go on to tip 4. Find your freebies. Who doesn't love freebies, right? So what do I see freebies as? That's data that you're already collecting. So this is a beauty because you can feed it into your evaluation, and it's not additional data that you're drawing out, which means it doesn't cost much. So when I talk about freebies, I'm thinking of easy observational data. Just to give you a very concrete example, if you were doing an evaluation of programs, maybe on a middle school campus, you could look at attendance records. You could see how many children are participating in the school lunch program. You could pull up health data, obviously in an ethical way, but just to give you an idea of what sort of freebies you can already pull in and that could feed into a broader evaluation. All right, let's go on to our next one. And then you want to automate data collection wherever possible. Now that word automate, usually I hear it and it makes me kind of want to cringe. But what I mean in this context is collecting data in a way that you don't even have to think about much. It's kind of embedding that data collection into whatever you're doing. And let me make it a little more real for you with an example. So right now, actually during the pandemic, my team was tasked with evaluating a youth passion seekers program. And basically this program is designed to connect youth to their passions, to careers, and help them ultimately find their path, into a career, into college and whatnot. And the program was supposed to be a series of in-person workshops where the youth would learn a lot about themselves. And because of the pandemic, now it wasn't going to be in person, but all these workshops are going to be happening virtually. And our team, which was tasked with designing a pre and post survey of, the Passion Seekers program, now as we were digging into it, we thought, well, since students are already doing things online, then how can we sort of automate some of the data collection? The survey questions, survey was getting very long. You don't want a survey to be so long. And it was actually the folks over at the nonprofit who said, I think we can just embed questions into the workshops themselves. So as students are participating in a workshop with us, before we go into topics around how to find their passion, we can just ask them to define what is a passion for you? And then use that to kind of guide the conversation. So it's serving two purposes. It's being a part of the workshop, it's embedded, it's automated, but then at the same time, it's collecting important information that you won't have to go back and change later. And so I think the gist of this is that with evaluation, you can do evaluation in ways that aren't as costly, that don't take as much time as you would think. It's about being creative and being intentional about what you want to do. And so we can just pass over to the last slide now. For those of you who love resources and want a Bible on this is a Bible. It's a 400 to 500 page book on real world evaluation, which is how it's really coined about doing evaluation under time, budget, and political constraints. So I highly recommend the book by Bamberger and Marbury. And then Michael Quinn Patton has done quite a bit of work with utilization focused evaluation, and there's a third resource there for those of you who are interested. So thank you so much. And I'm very excited to hear your questions coming up.
Yes, thank you, Kamala. One of the consequences of COVID-19 is reduced resources for evaluation. So your tips are very pertinent. And at this time, we would like to open it up for questions. And so please feel free to use the chat box. Please also feel free to turn on your camera and ask a question, or just keep your camera off. Perhaps while you think of your questions, I know I have one. And that is that it follows on Kamala's theme of resource limitation. And limited resources can also make it harder for programs to address equity issues. So I am wondering if that is something that you have faced, and if so, how you have addressed that, or if you have advice for any of our presenters on that topic, or our participants on that topic.
Thank you, Anne. I'm happy to get us started on that question. And I'm really happy that you're asking this too, because a lot of times when we're looking at simplifying the design of an evaluation and cutting costs, people can see this perhaps as hand in hand with letting go some of the values of that evaluation, like equity and inclusion. So my point here is that you can simplify the design, but that doesn't mean that you are giving up on the values that really guide your evaluation to begin with. And so there's several things that you can do. I remember when I was working with a faith-based organization where they didn't have such a large budget to do the evaluation. We were evaluating a youth empowerment program. And the design was for us to talk with a lot of the key informants, so the staff that were working with the youth, but not necessarily with the youth. And given that this program was targeting youth of color and youth living in the global South, it was especially important to hear, the voices of the youth. And so our team went back and we designed like a one-page worksheet that the youth could fill out. And we figured that program staff could give youth the worksheet, during one of their programs. And youth were very keen on filling it out. And they went ahead and they scanned these worksheets to us where there was information about the impact they were having in their communities, the strengths that they felt they had. So I think what's important here is, even though we didn't have much of a budget to do all of this, we were intentional, and so if you want to, be equitable, if you want inclusion to be a part of your evaluation, then you have to be creative. You have to think of different ways that you can collect this information. That would be one. And I would say another thing is just, if that's your commitment that you're making, then your questions should be surrounded around equity and inclusion. You should have those integrated. If you ask 3 questions because you don't have too much of a budget, then one of them should be about that.
Great. Any comments, Salaj?
Yeah, this is excellent points, Kamala. Thank you. Thanks a lot. I would like to add into those is one of the ways of in the finding budget is that finding allies. So for example, if other government program is also interested in the same area of evaluation question, cooperate with them. If they have data, use their data. So in these times, so finding these sources of partners and budgets really help in our program. So for example, building administration for each school is also interested in monitoring engagement or attendance of students with disabilities, and they have budgets from other sources that is coming in. So we are also kind of collaborating and using that budget to continue. So these some of the strategies are also helpful. Thank you.
Thank you. Grace, any thoughts?
Yeah, when we were discussing modalities for doing the knowledge attitudes practice surveys, it was really important to acknowledge that mobile data collection is inherently inequitable. You're already counting out everybody that doesn't own a phone from your potential sample size unless you are willing to distribute phones to everybody. So in some contexts, depending on the calling plan, costs can be incurred by the receiver as well as the caller. So one thing that we had to build into our budget was compensation for people in contexts where if they were receiving a call, that they would actually have a cost associated with that, so that we were sure that not only would we be introducing an opportunity cost in terms of lost time, but we didn't want to incur a financial cost for people to be on the phone chatting with us for a survey that was volunteer.
Thank you. We have a question in the comments. What are panelists' tips and tricks for high engagement during virtual focus groups via Zoom or other digital platforms? Anyone have any experience with that?
Yeah, I can share my experiences. So as I said, there was heavy reliance on focus group with students, and we had to now go on the virtual format. So one thing that we have done is that restrict size to 5, because students are not really that familiar with focus groups. So keeping it in 5, including their mentor or teacher, somebody they're familiar with, because there is no scope to establish that personal contact in the virtual setting. So just to make them comfortable having that person, sending questions beforehand so they know what is expected. So I know it's like we rely on sharing information that comes up, emerges through discussion, and this is more like following script. But in the virtual setting, that helps people really a lot if they know what to expect. And being prepared for the network issues, bandwidth issues. So setting up 2 time slots. So if in case the first one doesn't work out, you can have another one, just to have a plan B. So yeah, these were the things that we were trying to do, but I would like to know if other people are doing something.
Well, if anyone has any tips about that, please feel free. And also additional questions for our panelists.
I'm virtually raising my hand. Hi, I'm Tom Harmon. I'm a MINN board member. Thanks to all the presenters. This has been great, even for someone who's not an evaluator. So I'm trying to learn as I can. I guess I had a question about how evaluation is going to change. So I think you're seeing across a lot of industries, even if miraculously COVID went away, went back to everything being normal, you're still seeing a lot of discussion around, is there going to be more working from home? All these kind of societal broader impacts. How's evaluation going to change, do you think? If everything just miraculously went back to the way it was, how would things look different based on what we've learned in the last year?
Thank you. Wonderful question. Is there a panelist who'd like to start?
I can start briefly. Well, I think simply in light of probable limited funding and continued limited funding, the importance of really strong evaluation will be even more pertinent moving forward, because you have to have a really strong case for why your program should be invested in. And then maybe one of the other panelists has ideas on how evaluations can improve or will change themselves. But I think that the need to build it into budgeting for any program will be even more important in the coming years.
I can add into that. We evaluators were talking about this complexity, dynamic context for a long time. And this case really, it was like a textbook example of how complex things can be. So there will be a lot more in attention to how systems are linked, they're interdependent, and how we have to take cognizance of changing context. So basically, developmental evaluation frameworks or interactive you will see more of those uses. Other thing is that we will shift to online and digital data collection a lot. Now that we have got hang of it, I think it will be here to stay. Thank you.
Thank you.
I think in addition to the points that have been brought up with the pandemic in general, I've been reading a lot of articles around how the pandemic has highlighted the need of providing water and sanitation in different countries, and this urge to sort of track the sustainable development goals, including, the goal around water and sanitation. And so I think that now that we're in an age where we realize how interconnected our Earth is, we're going to be looking at joint solutions. So evaluation will continue to happen, but perhaps people will see themselves as part of a larger globe. An evaluation is moving from, something program evaluation, the way that we do it in the nonprofit sector, the global nonprofit sector. I see a lot of companies, like right now I work with Bank of America, and at our bank, they're also looking at how will we evaluate the sustainable development goals? What is the way forward? And so I think that these issues are becoming more highlighted, just this interconnectedness amongst us all. Is really going to shape the future of the field.
Really interesting point. Thank you. Other questions?
Hey. Yeah, hi. This is Adriana. I work with Children's HeartLink. Hi, Anne. I have a question to the panelists. Thank you so much for sharing your insights. Really interesting and so critically important to the work that we all do in the nonprofit sector. I wanted to ask you about observation. So a lot of the part of the evaluation that my organization does has to do with our medical volunteers who typically would have, travel to our partner sites in India, Vietnam, Malaysia, China, and Brazil, and would observe, in addition to talking to the clinicians, they would also observe the practice and the daily clinical work that these practitioners engage in. And this observation is a very important element of evaluation because it complements in a very important way what we actually hear articulated in words. And I'm wondering whether you had any suggestions or tips from your own work for how we can, quote unquote, replace this observation piece. Because so far what we have tried, on Zoom, there's a lot of sort of prepared statements and people share, things that they have already sort of thought about, and the element of spontaneity of a practice that we can see is not there. So if you could share any suggestions, I would really appreciate it.
Fantastic question, Adriana.
Thank you.
All insights, please. Vested interest.
I have a question, actually, clarification. So in your program, the observators are from, in the local context, from the same area or city, how it used to work?
Yes, so thank you. Sorry, I should have said more. So our organization works on pediatric cardiac care, and in order to enhance and support the program development, pediatric cardiac care programs in the countries where we work, we link up with hospitals in those countries who have pediatric cardiac programs and connect to them medical volunteers, often from Canada or US. And then we ensure that there is a mentoring relationship that develops over time, but typically pre-COVID, this mentoring relationship was really strengthened by the times when our medical volunteers could come to our partner sites, and partner sites could go to medical volunteers and really learn through observation, so for the partner sites, but also evaluate progress and impact of those teachings from our medical volunteers. And so I've always heard from our medical volunteers saying that asking directly what has been the impact of our collaboration is important and definitely is something that we do, but also observing in first person those practices and how they have changed over time is a very important element of the assessment of change. And so now that we cannot travel anymore, we do still have the partner sites on the ground and we engage them, but are unable to really have volunteers evaluate visually and sort of by just shadowing really the team what has been happening, and challenges and dynamics. A lot of them is team dynamics too. So not something you can really directly ask us easily.
Thank you. Thank you. And I am not an expert in this part of evaluation, I admit that, but some of the thoughts that come to my mind is that perhaps establishing partnership with the countries, the doctors, medical staff that is there in the hospitals, in the healthcare facilities, because you can provide them training on Zoom. So for example, if you want certain observation that to be conducted, and I'm sure you must have thought about this is pretty obvious, but having what we say local evaluators or local observers, training them rather than sending somebody from there. So more collaboration with the people from the countries who can, share observational data with you on the parameters that you want. Of course, the training will be involved, but that can happen on Zoom. But I understand that the shadowing part is something that is very difficult to come on Zoom. So establishing more local partnerships, I guess.
Thank you.
I could see that happening, for example, like if we could get adult cardiac surgeons and cardiologists to do the observation from the same hospital. Of course, using our checklists and protocols. Yeah, thank you. Are there anyone else? And other questions? We are at 1 o'clock. And so Nick, can I invite you to close us, please?
Sure, of course. All right, so again, thank you all again for attending. This has been tremendous. I'm just so excited for this discussion that we've had today. Again, please follow our social media feeds, check out our website to learn more about future events. You can become a MINN member to gain access to exclusive member-only content and benefits. And check out our Give to the Max drive to help power more of this great content like what you heard today. And links to that have been put in the chat as well. We'll also be sending out a quick survey, and if it's okay with all the presenters, we'll send out the presentations as well to everyone so that you can kind of follow up whenever you want to. And then the recording will also be available online probably sometime next week. So thanks again, everyone. Stay safe, and we'll see you at the next event.
Bye. Thank you.
Bye. Thanks a lot.